One of the biggest trends that is impacting the industry right now is the opioid crisis. And it's shocking that almost 78 people die a day due to opioid abuse of some sort. And so much of that is coming from legal prescription drugs that are prescribed in an illegal way. One of the most successful elements in the battle against the abuse is what we call PDMPs, or prescription drug monitoring programs, which are maintained in all but one state. And these are state databases of all prescriptions for controlled substances that have been dispensed. So typically pharmacies submit on a very regular basis, daily or weekly, whatever the state requires, to this database. And then that data is made available to prescribers, to pharmacists, also to law enforcement and state medical boards. And the objective is to be able to look at all of this data and determine, who are the fraudulent prescribers that are operating pill mills and just giving out prescriptions inappropriately. Who are the patients that are going from prescriber to prescriber, from pharmacy to pharmacy, getting an excessive amount of prescriptions for opiates? Because these are the flags that then law enforcement can get involved with.
Requirements such as New York's I-Stop legislation, which require all prescriptions to be written, have really driven the attention to other states for making requirements. So it's not going to be a surprise when different states require e-prescribing, including controlled substances, as well as requiring using the PDMPs, or even some states are requiring support of electronic prior authorization.
And if a particular practitioner or vendor is supporting multiple states, they've got to be aware of the various different rules and regulations and requirements around how electronic prescribing or electronic prior authorization, all those things have to be handled.
So EHRs have the opportunity to make a big difference in this opiate crisis by integrating these PDMPs into the workflow of the EHRs. It's a concept that's already been proven in pilot programs that ONC sponsored recently. So we think that the proactive EHRs will be the ones that are working on accommodating the prescribers and making this easier to do. Just as we've mentioned that EPA, electronic prior authorization, integrated into the workflow will also be of great benefit to the physician.